In the last lesson, you learned about CPR, and we tie that into today's lesson on taking vital signs on patients and the importance of that. So what do you remember from CPR that we talked about and that you read about in your reading?
That when you're giving CPR, it's important for them to lay on their back and you give 30 compressions to 2 breaths and you keep going until hope arrives.
Okay, good. So we give 30 compressions at 2 breaths, or 30 compressions to 2 breaths, and then 30 and 2. All right. At what rate of compression? So what speed of compressions are you going? Do you remember that?
100.
Good. All right. So you want to make sure that you are giving your compressions at a pace of 100 pushes or 100 beats per minute, give or take. Typically, it's okay to be a little bit faster. They say between 100 and 115 is where you want to go. Anyway, so today we're going to talk about vital signs and the importance of them, kind of what different things that we look at when we're taking vital signs as emergency responders, what ways to take these, and everything like that. The first thing that we're going to do today is we're going to do what's called a 2-column chart. And this is something that you'll get started on in this first part, kind of as we're talking about vital signs and as you kind of start to get interested in the ideas and build on as you go. Something that you'll do in a little bit also. But if you run out of time, it's something that you might have to take home later to do. But the purpose of this 2-column chart essentially is a good organization tool to break up the main ideas or what you're reading about and what we're talking about in here into just kind of broad main ideas and then giving some supporting details or some information on the side to help you remember those details so that when you go back later on, again, you can use this as a study tool for when you're reviewing for the tests coming up, whether it's to fold your sheet so that you only see the main ideas and you kind of try and teach yourself like that, or however you want to do it. So the first thing you need to do is just take out a sheet of paper and tear it out, and then what you'll do is you'll fold the left side of your paper in about 2 inches or so, no big deal, and then you'll just kind of draw a line. And I did it up here on the board to give you an idea of what you'll want to do. Alright, so then you just draw a line, and then the first thing on the top that you're going to do is you're going to write the word objective. Alright, for the objective, you're just going to write this right here. You can write it as we go. But that's basically what you're doing today. So the objective today is the student will describe the importance of checking patient vital signs when arriving at an emergency scene. Okay. So as we go through this, and as you're reading through this PowerPoint packet that you're going to get, it is kind of lengthy, so you want to make sure that you're paying attention to the actual content in it, so that you can determine with me where the main ideas are and take from there. All right. So just before we start writing anything down, what do you believe to be one main idea for vital signs?
Main idea.
Like what do you think vital signs is about? You may not really know about it yet, but what do you think vital signs entails?
Like the important things that people look for as a doctor.
Okay. All right. Well, good. All right. So remember that vital signs are just these sets of clues that help determine the patient or help give characteristics of the patient so that it can help the medical responder in what they need to do. It kind of gives them some additional information that the patient may not be able to tell. So when we're doing vital signs, we're doing a set of checks of the patient's blood pressure, pulse, temperature, oxygen levels, something else that I lost my memory now. But we're doing all of these different checks again to make sure that there's nothing going on the inside that you can't see from the outside or however. So if you're an EMT or you're a paramedic and you're responding to a scene, the first thing that you're going to do is check vitals, because the patient's probably going to give you their chief complaint or the reason why they called if they can, but you're going to check these to make sure there's nothing else wrong. So if they say they've got a cough that caused vomiting or something, you're still going to take their temperature to see if they've got a fever, to see if they're fighting something off. All right. So as we go through again your reading, we'll just do the first one. But the first one that you're going to do is the idea number one may be the actual word vital signs. Okay? And in your reading, you'll see that vital signs are the most important clues or signs that are important to individual life. Okay? So within that, you may put in here what we just said, but you also, as a supporting detail, may put sign versus symptom. Okay? And then you'll want to explain what that is, obviously, because you want to know that a sign, or kind of what you physically see, may be different from a symptom, what you feel. And that's what that says in there, is that a sign is something that can be seen or observed that can be recorded. So an example of a sign may be skin color, breathing rate, pulse rate, and blood pressure. All right? Hence why you've got vital signs. All right? Whereas a symptom is something that can be experienced and described by the patient as it pertains to the chief complaint, which, like I said, could be anything. So in this case, the example that I have for you all to go through is that the chief complaint or the symptom may just be pain. Stomach pain, headache, cramp in their legs. Well, those are good, but they can also be very generic. So you need to know the vital signs to really understand what's really going on with your patient. All right, so that might be for the first main point that you have. You put the sign versus symptoms in there. You might go through some of these examples so that they give you a better idea. All right. But again, one last thing that you're going to put is that vital signs include checking respirations, pulse, blood pressure, and then that last one was skin. So the skin coloration, determining if it's a normal color, if they have a cyanic color, which is a bluish tint, meaning they're not getting enough circulation. If it's a yellowish tint, meaning they've got some sort of jaundice, which therefore relates back into the liver. So all these different signs to help you understand what's really going on. So what you're going to do is we're going to go through this next one. The next idea, main idea that you might do is breathing. All right? So breathing is going to be your main idea. And then you might go through and you're going to read about breathing and the importance and what clues to look for, and analyze and really think about why breathing is important to your baseline vitals or your vital signs checks. Okay, so we're going to go through that, and you're going to complete this this 2-column chart just kind of as we go. Like I said, if you don't finish it, you can work on it in a little bit. And then we will move on to the next thing. All right. Do you have any questions? All right. We'll go on and start looking through that. You can read through your PowerPoint. Really take your time on it and really analyze it to determine what your main ideas are. All right, remember that it's a study tool for you. So what's going to be the best things to help you remember what that key word or key phrase is? All right, so we just finished up on our 2-column chart. I wrote down just some of the basic ideas that you told me, but there's also more in there that you've got on your paper. For this last part of it, once you guys finish going through the guided reading activity that you'll do next, the final thing that we're going to do today is what's called the free write activity. Essentially, this is just my opportunity to gauge your understanding from what you've read today about vital signs. So with this free write, it's essentially kind of whatever comes to your mind in regards to the prompt that I'm giving you, or to the idea that I'm giving you to write about. You'll take just a couple minutes to write it, and then we'll turn it back in when you're finished, and we'll be done with this lesson. But the prompt that I have for you guys to think about as you finish reading was to think about the purpose of vital signs, why they're taken and when they're taken. So as you're brainstorming, you're thinking about the different things that you've read with all of that information. Just pick out the key points, why vital signs are so important, why do we use them, and then how often do we take them. All right, remember that we have to take them at a certain time based on the priority level of our medical patients. Okay, so finish up with that, and then we will be able to be done with this lesson. You can go ahead and get started. One thing that may help you, not necessarily in this free write, but as you go through, and this may be done after we get done with our free write, is to just kind of think about the difference in priority of these signs, if there really is a priority of checking one's pulse over the blood pressure or not. So that might be one thing that we discuss and kind of put into a chart once you all finish that. But go ahead and finish that, and then I'll take them up when you're done.